Hi everybody, it's Dr. Newman. I had a patient ask me today, it's a patient who's going through breast cancer reconstruction, who is going to need radiation therapy, and she's a patient who is already at the conclusion of her reconstruction, already has her implants in place and has a nice reconstructive result, but they're now deciding that this patient needs radiation therapy, and she's asking me about how that will affect her implants. And the truth is that radiation therapy does affect the implants and may affect the capsules of the implants. It doesn't do anything to the implants that affects their longevity, but sometimes patients after radiation therapy can get changes in their tissues, and those tissues may tighten around the implant, capsule contractures, or even their natural tissues around the implant. That sometimes causes compression of the implant and changing to the patient's shape. It's not unusual for an implant to have to be changed down the line after radiation therapy, and sometimes that change ends up being much sooner than implants would ever get changed routinely. Radiation therapy is something that's part of many patients' postoperative breast cancer treatment, and when patients are having any kind of breast reconstruction, that can potentially affect the implants, the longevity of the implants, and what we need to do to kind of maintain that result. So that's something that you should speak to your doctor about. Make sure that you have a plan, and it really depends upon the stage of your breast reconstruction, whether you're somebody who still has a tissue expander in place or whether you're somebody that's already beyond that and now has your permanent implant in place. They can all be affected by radiation therapy, and it's a conversation that you need to have with your doctor.